Hello, and welcome to The Inside Scope, a podcast from Lakeland Regional Health, where we share insights from experts providing award-winning care here in our community. I'm Dr. Daniel Haight, Vice President of Community Health here at LRH. I also have the privilege of hosting this podcast. I'm excited to introduce our guest today, Dr. Mario John, an orthopedic surgeon who specializes in joint replacement. Dr. John completed his residency at Howard University in Washington, D.C., and went on to fellowship training in Virginia Commonwealth University. He's published academic research with some of the most foremost authorities nationally, and his goal is to help people return to active lifestyles in the shortest time possible in a safe manner. We're glad to have him on the podcast today to talk about hip and knee osteoarthritis. Let's dive in.
You know, what I like about being a doctor is you get to sit with a patient, have a great conversation, and ask, what's most important to you? But since we're here today, what's most important to you as a physician?
So as a physician, of course, when dealing with patients, I want the absolute honesty from my patients because me too, I want to be absolutely transparent. I want to help them in the best way possible. And of course, once they indicate to me their issues, their problems, especially within my subspecialty of hip and knee replacement, I can, better serve them, better educate them so they can make informed decisions. So it's very important that they are very transparent and they're very honest about their conditions.
And I tell you, the aches and pains in the knees and hips, I'm feeling it. I see a lot of other people as the years go on, getting a little slower. What's actually going on there with this hip and knee pain?
So it's very important that we address these issues, especially in our demographic here in Polk County, in Lakeland. Florida, it's a area, the demographic is a 55 plus community, very active, a lot of weekend warriors and people from out of state, they come here to enjoy our weather. And it's very important that we keep patients at a high level of functioning and we keep their pain under control. My philosophy is, treating patients with non-surgical options first. And once they fail these non-surgical options, then we can consider something surgical so they can get back to their active lifestyles in the soonest possible time.
Well, it sounds like the first step is to really recognize that I am starting to have this interfere with what I like to do and I want to keep doing things. I need to start to ask a few questions and get some help.
Yes, especially when what you are planning on doing or you want to do starts to affect your quality of life. For example, a lot of patients want to go to Disney World on the weekend with the grandkids. They want to play their golf. They want to play pickleball. During the summertime, people go to Publix just to walk, to keep active, so to speak. So, you always want to maintain that level of mobility. You want to maintain their active lifestyle. So it's something that, we should always look into, making sure that the pain is well controlled.
Is there something I should do if my knees are starting to ache me or my hips are starting to ache me? What should be one of the first steps I should try to do?
Well, the first step is that you always, of course, you engage the healthcare community, engage your primary care doctor.
Get some expert advice.
Get some expert advice, yes. And, ideally, the physician evaluating you will take a proper history, ask the necessary questions, do a physical examination.
Ask what's most important to you.
Ask what's most important to you. And then, of course, do things like x-rays, do investigative studies to make sure that they can make a diagnosis.
I tell you, with so many folks I've known, and I grew up, my dad's a retired sergeant, and, I was talking to you earlier, and you mentioned how we have veterans that were jumping out of airplanes. We have people that have been on their feet all day long for all their career, and now they want to enjoy the 50s and 60s and continue to be doing what they want to do.
Yeah, so of course, some of these are the risk factors for having this hip and knee pain in these latter years. And, you'll have things like trauma of patients who have had fractures, people who have had these occupational issues, the truck drivers, the parachuters, the vets. Mm-hmm. And in addition to the people who are just active and it's just pure wear and tear of the joints. And it's kind of akin, Dr. Haight, to the tires of a car being smooth. The more active you are, the more mileage you put in, the tires of the car will get
some old tires, and they're a little rough around the edges.
Exactly. So it's kind of like that, where the joint actually wears over time, and when that pain really starts to hit you and it starts to affect you, this is when you can engage someone like myself to have that conversation.
And I can see that, I want to start sort of slow, understand what's going on with my body. What are some of the first steps I would take if I wanted to start to head in a direction to reduce some of that discomfort and be more mobile?
Well, first, there's always a number. There are a number of ways and means of targeting hip and knee pain. In my case here, you could, of course, there's benign neglect. You can do nothing. Okay, as I always give the analogy.
I'm good at that. Yeah.
I'm always good at the. I always mention the analogy when your grandfather, back in the days, they didn't have any surgery, they didn't have medication. They just took a old walking stick, and they negotiated the uneven ground, and they lived with the pain. Then we have other things like medication, we have walking aids, we have injections to the hip or the knee, and
so there's a lot of non-surgical approaches that might be right for me.
Definitely,
and I can see where they will have their benefits, they might have their drawbacks, but I think it's understanding, being able to ask questions.
Most certainly, and it's a tiered approach. You're not going to throw everything in the kitchen sink at the patient. You start off with something like Tylenol, then ibuprofen, and then
see
you can
how it works.
See how it works, and then depending on the level of response, you can take the necessary measures to improve the care or to tear the care upward. For example, going with prescribed oral anti-inflammatories or even injections. And even in the injection world, you can try steroids versus viscosupplementation. So there are a number of modalities we can try to help control pain.
Plus, it's all the partners you have. I see it at Lakeland Regional Health. It's the doctor, it's the nurses, it's also the physical therapists. This is the best exercise for you. This is the way to keep your muscles stronger. Do you work closely with the physical therapist?
That is an extremely important part of the healthcare team, the physical therapists. They also help with, of course, getting that strength and mobility into the patient, but they also work with other aspects of the healthcare team, for example, the nutritionist, because weight loss is very important. The heavier you are, the more joint pains you have the potential of having. So yes, the physical therapists are integral for the prehab, let's say before surgery, and even after surgery, the post-operative rehab.
Well, I've always heard about that osteoarthritis, where it's a wear and tear kind of arthritis, and it's the kind of thing that when I've played some sports with folks, they'll say, I have bone on bone, meaning I guess that cushiony cartilage that's usually between the bones is worn off over time. And now you're just getting the bone. In fact, you can hear the joint cracking and popping when you move it. Yeah.
Yes. And it's very important to understand the natural history of the disease. Of the disease. So cartilage really lines the joint, and it provides a low.
It's where the two bones meet. It's not bone, but it's when we're born, it's like cartilage, it's like nice and soft.
Yes. So, like for example, in the hip, it's a ball and socket joint. Okay, it's like a ball and a socket, and the knee is like a hinge or the hinge of a door. It's a hinge joint, and on the ends of it, there's cartilage, and the cartilage provides a very much of a low friction environment.
Starts off smooth,
so the range of motion is nice and smooth. But over time, there is wear across the cartilage.
And that's where the inflammation starts, exactly. And that's where some of the medicines can help keep it from bothering you.
And the term for arthritis, or the most common form of arthritis, is osteoarthritis. Osteo meaning bone, arth is joint, and the itis is the inflammatory component of the disease.
And I can see where the medicines work with that. And I think if I could see where that would work for a while, but then at some point, medicines have done all they can, and I have known a lot of folks where they've gotten relief from a hip or knee replacement. But you need to get ready for that, right?
Sure. So exactly. When you exhaust these conservative measures, or you exhaust
the medicines,
the non-operative modalities, then you can start thinking about something surgical, because then now there's nothing that can help the patient. The patient still wants to continue with the active lifestyle. So doing a hip replacement or a knee replacement can be the next modality.
Because, when I asked somebody, what's most important to you, I thought it might have been relieving the pain, but they said, oh, no, I want to run a marathon with my daughter in a month. And says, well, that might help then say, well, let's make sure the medications keep you going. But eventually, there's the surgery. Do you have to be out for a while once you get a hip or knee replacement?
So in this modern era with hip and knee replacement, of course, once we get what we call medical clearance, your primary care doctor,
your heart is good, your sugar is controlled,
your sugar is controlled, you've met certain metrics, your BMI is controlled, as in the body mass index, you've met certain metrics, you can have a hip or knee replacement. And in this modern era, patients go home same day. This is a same day.
So you get your knee, it's not two at the same time, but you get like one knee replaced.
You can do
The one that's usually the worst
the
knee.
worst. You can get it staged, or you can have it. Have it done simultaneously. But I
okay.
typically do it staged. And yes, you can go home with the hip or the knee. You can go home same day, and you start having physical therapy that day.
So after surgery, if you're doing pretty good, you can go home. And then, of course, there's a lot of that. You mentioned those partners, those physical therapists.
Yes,
They make
yes.
sure that you're going to work hard
Yes.
to get that function and get the pain better controlled so that the joint works.
And their role and function is to really push the patient beyond that limit where they're trying to not do as much work. They're trying to be as mobile as possible. And the mobility really helps with things like clotting in the legs that can go to the lungs and pain control and that sort of thing.
And I tell my patients to be strong in the arms because it's those arms are going to be taking up a little bit of the weight load when you got a knee that's healing.
Yes, and typically I do prehab so the patient understands the expectations.
Instead of rehab, you do prehab.
Prehab, yes. So like
surgery.
before surgery, you do physical therapy so the patient understands the expectations and they can have that conversation with the physical therapist so they understand what is to come.
Is there a class you take before having a surgery like this, if it's well planned and you know you're getting ready for it? Does a patient and the family get to have like a class?
Yeah, so at Lakeland Regional, we do have what we call like a joint camp where they can start talking to the nurses, they're talking to the staff at the hospital. We take them through a nice booklet we have prepared for them that will show them exercises, talk to them about pain control, talk to them about nausea, vomiting, some of the things.
Well, I bet that makes it easier for them to talk to their neighbors who they know have had the surgery. Because they'll think of a question, and then of course their neighbor said, "Yeah, I went through surgery last year, and make sure you ask this question, or make sure you do this ahead of time."
Yes.
So that makes it all a little better educational.
But it's also very much for the patient to understand the expectations of surgery so they don't have any surprises. They don't say, "Oh, I didn't know the pain
There
would
will
have been
be
like
some
this."
discomfort.
There will be some discomfort, but
you'll get through it. Yeah.
They know how to troubleshoot throughout the post-operative
how
process.
to heal properly, how to change the dressing, when can you take a shower, all those things.
All those things are addressed.
Those are great questions. And you don't go it in alone. I just noticed in medicine, whether it's your heart or your knee, you're not alone in this. You have friends and family, neighbors. You also have your doctors and nurses. And I just think, don't go alone. Make sure you have that kind of wraparound support.
Yes, and that team around you.
Yeah,
yes.
That's great.
Yeah.
Well, I think and then you start to look at how you can get them through that first surgery, and then you do the other one going from there.
Yes, of course. We get them through, and especially if they have arthritis of both the hip and the knee. I tend to do it stage based on, patient has one joint, they get rehab, they feel more comfortable, and then they can go forth and do the other joint.
Well, there's just tons of questions like what's the best stage, what's the best timing, but the key is to actually sit down with an expert such as yourself to say, I have these particular questions, and this is what's most important to me.
Yes.
And I always say, bring a little short list of questions. I
Yes.
bet you have patients that say,
yes,
I want to make sure.
I have the patients who, I call them the Wikipedia patient, who will come with a stack full of things. But the key is to always have time for the patient, always try to be honest and answer as many questions as you can, because this is going to help their outcomes.
Well, there's these, certainly as I'm reaching for the door of the car, I'm like, I want to ask this question. And I think what's been good is there's always that inlet back end now with electronic health records and ways to message your doctors and the team. Is if I think of a question and I'm at home, you can
Oh,
get that
definitely.
question
So,
back
like
in.
for example, at Lakeland we have something called My Chart based in our electronic medical record. So there's full access to the healthcare team to ask the necessary questions if you need to clarify something. For example, if something is not set up like your physical therapy after surgery and everything, all of these things could be addressed via our electronic
I
medical.
love that connection, because when you have the orthopedic surgeon talking about a plan, they're in such close communication with the heart doctor that might be taking care of high blood pressure, and then your main doctor taking care of your diabetes. It all comes together to make sure that surgery is successful.
Exactly, yes.
And even before that, even the pre-surgery, if you're just controlling with medications, one medication should work well with the others. And I like how y'all work that together.
Yes, exactly, yes.
Excellent. Well, perfect.
Yeah.
This has been enlightening. I always learn something each time, I think about it. I try to put myself in the patient's position, and just having someone as reassuring as you just to be able to guide me through that process. I know a lot of friends and family are thinking about it.
Yes.
And as I see, some folks say they do muster up the time, and there's time to take care of yourself.
Yes.
There's time to do something about it.
But it's also very important that the levels of anxiety for the patient and their family is kept at a minimum, so they have a very good experience throughout the whole process, and they're well informed, they're educated, so they feel comfortable throughout the whole process, so they have a good outcome. That's most important.
Oh, exactly, because they might have seen something on television.
Yes.
They might have seen something with a relative in another state.
Yes, exactly.
Got only part of the information. Now we're able to say, how's this going to be with you? Because I'm getting to know you. I get to know your history, even your family history.
Yes.
And that makes it understandable that I have a medical home. And that's what I think Lakeland Regional is providing.
Yes.
This wonderful, wonderful medical home.
Yeah,
They know me.
Yes, and especially at Lakeland Regional, we are, one of the busiest hospitals from the emergency department in the country. So we see a heavy volume. And because of this, we have expert doctors, especially in the orthopedic department. We are all subspecialized. We have a full trauma line. We have adult reconstruction or hip and knee replacement in myself. We have sports medicine. So we have a full gamut of orthopedics here at Lakeland Regional. And it's all about, it's very patient-centered and patient-driven.
Well, we're certainly going to be learning about this in the future, because I want to go through when it's beyond just the hips and knees, and we're talking about ankle injuries and how to keep that back nice and straight, and how to deal with the occasional trauma. So in the future, we're going to have some great conversations.
Sure.
So,
and for me in particular, though my subspecialty is hip and knee, my niche is the anterior approach. So when I do my hip replacements, I go through the front.
Sorry, how do you do the specific
How you
surgery?
do the
There's
specific-
different ways of
Yes,
doing the surgery.
especially in the hip world, where the anterior approach, and the advantages within the first 6 weeks, patients rehab a little bit better. They have less risk of dislocation in my hands, that sort of thing. It's minimally invasive. The patients qualify. The incisions are very small, and patients, of course, do quite well post-operatively, and they like the aesthetics behind it as well. So
Well, that's where a well-informed patient, it's not just hip surgery. It's a specific way of doing the hip surgery, and it's also tailored to what the patient is saying. This is what's most important to me.
yes, and also we have, part of my wheelhouse is the robotics as well. Do robotic total knee replacements. That's a new era. That's a new wave. But again, patients are coming very informed. So the doctors have to also inform the patients as to what is evidence-based, or what is true.
Proven to work.
Proven, yes, as opposed to just things off the internet. So it's very important that we keep up and we know how to communicate this with the patients.
Well, Dr. Mario John, and I really appreciate what you've informed me about. And your office is at the Grasslands facility on Hardin?
Yes, 3030 Hardin Boulevard at the Grasslands facility. We have a full orthopedic office there with x-rays and physical therapy and everything. And it'll be a great experience once you engage our orthopedic department.
Well, terrific. Well, thank you again for all this information. You have a wonderful day. And thanks to our listeners for expressing the interest. They're interested in it. We're glad that we're able to answer the questions that you have. So thank you very much.